Vicki, it's so interesting hearing you start to talk about accelerated resolution therapy or ART. And I heard you mention something about changing the way a person sees or feels about the problem. Could you say a little more about what that looks like?
Um, what's beautiful about what we can do with the eye movement process is number one, the brain likes it. This is like our REM sleep, rapid eye movement sleep. It's familiar with it. Okay. And it also, the process brings us to a place the individual can be more calm and more regulated. The heart rate may go up in the beginning, but it will always level off if it's working in the direction that they want it to go. So the important thing is what happens at the beginning is asking them, how would you like to feel differently about this scene, this experience that you had in your life? And then once we name that, then it's like, well, how would getting rid of the problem help you and help others? So I always remember that. I've also always, before going into the art session, have done screening tool. I do screenings of it for the traumatic stress, for depression, for anxiety, and resilience. So we bring all that into the process. And we can actually have the individual do what's called voluntary image replacement, okay? Where you bring the image up, because every time you bring an image forward, studies have said, research shows it's already changing. It's already changing when you make that phone call, when we have that intake, okay? It's called epigenetics. I don't mean to get scientific, but it's just say this because the power of the process still surprises me. And I've been doing this since 2008. So, and then we can move into what's called positivization, move the individual towards how they are achieving what's looking and feeling different now about this. Okay, for instance, a Gestalt technique is a technique where an individual can be sitting in their chair here, but when we're doing the process of seeing their 12-year-old self with the eye movements, the power of that is they can go back as an adult here, as a parent, if they weren't parented in the way that provided them security, that they weren't felt they were not seen, they were not soothed, and they were not given a sense of safety or security. So there's the opportunity to go back with the eye movement process and have a conversation, give her a hug, okay? Retrieve them from a situation that they couldn't get out of.